Now, perimenopause, period changes, what you need to know. Now, everyone has different period experience. Normal flow before perimenopause can be heavy, light, or medium. The cycle can be long or short. But there's usually some sort of pattern or routine that's kind of your normal. Now, for those of us not on hormonal medication or birth control, any period changes in perimenopause can be a really good indicator of which stage of perimenopause we're in. Now, in early perimenopause, somewhere in our late 40s, for most of us, periods can become heavier, the cycle can get a bit shorter, PMS can worsen because as we approach the menopause years, we may not release an egg or ovulate as regularly as we did in the peak fertility years. The body, because it's determined to squeeze out the last few eggs, will release extra follicle stimulating hormone to jolly up or increase ovulation. It results in a peak in estrogen or estrogen dominance where progesterone levels may not keep up with the estrogen spike, and it can give us PMS with bells on. So increased breast tenderness, tiredness, mood swings, irritability. Now in mid perimenopause, periods can become quite erratic, sometimes with no discernible pattern or flow. And for many women, this can kind of be the most difficult stage because estrogen levels are kind of high one minute and low the next. And the instability can be quite tiring. Now, if there's any sleep or stress issues, it can feel a bit overwhelming and it can fuel anxiety. Now, give yourself plenty of rest and relaxation and support for the nervous system. It can really pay off. As you get closer to the end of perimenopause, estrogen levels will get progressively lower. You might feel a little bit of flushing at this stage. Periods will get lighter for far apart. Eventually, they're going to stop coming, but you won't be out of perimenopause and into menopause and considered to be post-menopausal until you haven't had a period for 1 year.